Okay, everyone, I think we're going to get started. My name is Ellen Thompson. I'm the chair of the System Strengthening Working Group. I'm really excited today about our webinar, Supply Chain Data for Advocacy. Data is a dialogue. So this webinar is the third one in our series about data as a dialogue. And Jay will talk a little bit more about what we mean by that, but today's country focus will be Tanzania. So we have an exciting lineup for you. I'm going to turn it over now to our moderator, Jay Gribble. Jay brings more than 30 years of experience to the field of international family planning, bringing expertise in policy, research, and communication. As Deputy Director for Family Planning and Reproductive Health on the USAID-supported Health Policy Plus project, Jay provides oversight of a broad portfolio that includes costed implementation plans development and execution, development and applications of policy models to generate support for family planning, and the work on the linkages between family planning and other health and development issues. Jay is involved in other family planning initiatives, including the HIP technical working group, where he has served as lead author on two high impact practices briefs. Jay has also authored a variety of publications on issues related to family planning, including contraceptive security, youth, and the demographic dividend. He's an avid user of social media and blogs on a range of reproductive health issues. He holds undergraduate degrees from the University of Texas at Austin and master's and doctoral degrees from Harvard University. So with that, I will turn it over to Jay.
Thanks, Ellen. And good morning, good afternoon, good evening to everyone. We're happy to have you join this third webinar in a series on supply chain data for advocacy. Focus of today is this idea that data is a dialogue. And I'd like to take a minute just to talk a little bit about kind of the evolution of these three webinars. The first one provided an overview, and it focused on PMA 2020 data, which are collected in several countries, and it gave examples of how data from these countries have informed a range of advocacy initiatives. Some of the examples included availability of IUDs in Kenya, or charges for contraceptive commodities in Nigeria. So the range of issues that PMA data can support for advocacy is really quite broad. The second part of that webinar looked at the role of the advocate in using that data. And we know that data can be very complex, it can be overwhelming, and it's the role of the advocate to take the data, to distill it into some key messages that support the issues around which they're advocating, and then work to reach decision makers to make the case for what they want that audience to do. What's the policy change that they are looking for? So the advocate really has a tall order, and the importance of this dialogue, I think, became clear in the first webinar. Data is a discussion, and it's not about taking the data and making it simplistic, but rather simplifying it and making sure that the data that are used are context specific, that they support the key advocacy message, that you're using what you need, not more than you need, but also making the case logically. So there is a dialogue, a dance, a relationship, if you will, for successful advocacy of ideally working with the data collector to make sure that the information that is needed is in fact included in the data effort, and then working with the advocate to ensure that the richness of the data is mined and that the advocate understands how to interpret and is able to effectively use what is available to charge forward with the advocacy effort. I really liked something that came out of that webinar. It said data plus human story plus right messenger is more effective than data alone. I think that reinforces the point that data are important, but they need something to breathe life into them, and that human story and the right messenger are critical to getting the attention of the decision maker. So those were some of the points from the first high-level webinar. The second one focused on East Africa, and it looked at issues related to equipping healthcare workers with critical supplies for family planning and reaching the right decision maker with the right message at the right time. So again, reinforcing this message of data on one hand and using it for advocacy and understanding kind of the timing and the importance of the messenger. Today is the third and last webinar in this three-part series, and we are focusing on Tanzania. And we've got two really well-qualified people to lead this, our discussion today. The first person is James Mlali, who is a policy and budget analyst with extensive experience in family planning advocacy, using evidence and research for influencing decision makers at national and subnational levels. He's an advocacy technical manager for the Advanced Family Planning Project within the Johns Hopkins Center for Communication Programs in Tanzania. He's contributed to different papers and literature on reproductive health and family planning advocacy, including one entitled Toward a Common Framework for Measuring Government Spending on Family Planning, another one called Christianity and Family Planning, a third one called Influencing Government Health Budgets in Tanzania, a guide for civil society. Furthermore, James has experience as a pastor, as a Bible instructor, and a university lecturer, functions that have exposed him to various contexts and opportunities for extended learning and growth. So before turning the floor over to James, I'd like to just mention a couple of logistical issues. On the right side of the screen, you'll see several tabs starting with webcam, audio. If you go down to the fourth one that says attendees, you can see who is participating in this. And the fifth column there is to raise your hand. So during the question and answer period, if you want to ask, a point of clarification, feel free to raise your hand. That's one way of getting attention. And then two tabs below that is the questions tab. And if you open that up, you'll see that you can type in your question, and what I can do is pose the question to James and Michelle Weinberger, our second presenter today. So if there aren't any more issues, I look forward to hearing what James and Michelle have to talk about in the Tanzania context related to data and advocacy. And then I look forward to a rich discussion that engages all of us. So thanks very much and welcome to the webinar. James, take it away.
Thank you very much, Jay. I'm joined with Halima Sharif, the Director for Advanced Family Planning Project in Tanzania, and we are very delighted to be part of this important webinar. We are talking about data use for advocacy, and this is the case of Advanced Family Planning Project in Tanzania. Next. Next, please. Advanced Family Planning Project is an evidence-based, locally led, and collaborative project with a goal of increased financial investment and the political commitment to achieve the goals of the Family Planning 2020 initiative and ensure that access to voluntary high-quality family planning is expanding. It has several objectives, which include mobilizing and sustaining effective family planning advocacy, amplifying voices from the Global South, and diffusing advocacy best practices. It utilizes a smart approach to deliver messages on advocacy. Next. The sources of data that we use for advocacy as a project in Tanzania range from government and other sources generated by other stakeholders. But I would like to mention a few. The National Bureau of Statistics in Tanzania issues reports that constitute the main source of data that we use after analysis. It has reports on population, like census reports, population projection reports, gender issues, child poverty, employment, and economic status. But also we conduct some rapid assessments at sub-national levels, particularly in areas where we do advocacy, in addition to one that we update every year for the national level to just update ourselves on what is going on and how the situation is in regard to family planning in the country. We also do policy analysis at national level to inform our advocacy. Next, please. Next. Yes, thank you. Some of the other sources of data include analysis reports generated by our partners like Population Reference Bureau on DHS particularly. Palladium has generated some analysis reports on Impact Now model and family planning and the Sustainable Development Goals model. But also Pathfinder International has worked with AFIDEP to generate data on the demographic dividend model for Tanzania. We have been using this. And finally, Avenir Health, through Track 20, has been generating very useful data on family planning progress in the country. And this is, I would say, one of the most important sources of information that we have been using for advocacy in our project. Next. So I'll explain a little bit how we use this data as advocates. As I mentioned earlier, we conduct some landscape assessments when we target areas and some national level to inform our SMART objectives and help us to address family planning policy, funding, and visibility issues in the initiative that we conduct. But also we use this analyzed data by the partners that I have just mentioned to strengthen our advocacy asks for targeted decision makers. And to do this, we package this information or this data for specific policy issues in policy briefs for decision makers, such as members of parliament, cabinet ministers, and district level councillors. Next. We use this data to engage our national and subnational leaders to take action on family planning, but also to mobilize civil society organizations to amplify the voice for family planning, and also in developing materials that I have already mentioned, like policy briefs, infographics, sometimes videos focusing on adolescent and youth as a growing population in our country. And this is something we have done particularly with a partnership from PRB, Population Reference Bureau. Last year, they helped us to develop very specific policy briefs, infographics, and videos on youth and adolescents. But also we orient journalists using this data and the data analyzed to facilitate them to provide a fair and balanced way to report on family planning in the country. Next. Now, focusing on data from Track 20, how we obtain and use it, we are good participants of the consensus building workshops that Track 20 organizes. And in this workshop, we capture the data on women of reproductive age reached with family planning, but also the situation in regard to maternal deaths that can be averted as a result of family planning accessed, unintended pregnancies that can be prevented or that have been prevented, and unsafe abortions that have been averted or that can be averted as a result of increasing use of family planning. Data on high impact interventions across different sectors and geographies is also one that we take and use, particularly in regard to postpartum family planning, investing in adolescents and young people, strengthening commodity supply in private facilities, and also in regard to community access to family planning. And it makes our family planning argument very strong and very not simplistic, but simplified for decision makers to understand. Next. Now, as a result of the use of this data that we package in PowerPoints and policy briefs and share with the decision makers, we have seen that members of parliament have sustained advocacy for increased family planning resources, particularly allocations in Tanzania. Looking at the past 3 years, we have seen a growing trend in family planning allocations. We can see that in 2015-16 financial year, the allocation was 5 billion Tanzanian shillings, but the next year, which was 2016-17, it grew to 14 billion, and for this current year, the allocation is 22.5 billion Tanzanian shillings. More civil society organizations are empowered with data to enhance family planning and reproductive health advocacy. We have a number of examples, but for now, we can mention a youth coalition that we have been grooming or working with called TIRE, and the National Family Planning Technical Working Group. We see the partners there also using the data and reinforcing advocacy with empowered ways of communicating and delivering messages. But also, as a result of the use of this data, the government of Tanzania was able to launch a campaign or declare a campaign against teenage pregnancies in the country. And this was done in October 11th last year. Next. Furthermore, there's been more movements or actions, including seeing that postpartum family planning and adolescent reproductive health indicators are included now in various initiatives, including a maternal mortality reduction campaign scorecard that has been developed to support the campaign, and also the ongoing updating of the One Plan 2, which is currently in progress. Local government authorities are increasing efforts in family planning interventions and allocating for family planning. Like Katavi region also developed an action plan last year and launched it to address teenage pregnancies in the region, because it's the region with the highest rate of teenage pregnancies. Another region is Geita, which has issued a directive to its councils to include interventions on PPFP in the plans and budgets. But also Manyara and Katavi again are developing strategic plans on PPFP interventions as a result of advocacy efforts informed by the data. Next. Now with that, we also see some challenges, particularly in our country. There's low transparency in terms of data availability. And I think this would have been worse if it wasn't for partners like Track 20, who are accessing data from the government and analyzing it and making it accessible to us. But this low transparency is limiting our ability to analyze data in especially subnational areas for advocacy. For instance, access to budget books and spending reports is becoming difficult by the day. So this actually limits our ability to track spending, particularly for family planning funds. And the data used for decision-making to improve family planning programming is still low, and the locally generated data is inadequate. And this also presents a challenge at those levels, particularly lower levels from district and below. I think this is the end of my presentation. Next, just to be sure, thank you very much. And we want to specifically thank Track 20 for being very supportive, for doing the analysis and making them available to us. Thank you.
Thanks very much, James. Good, interesting presentation that talks about some of the experiences in Tanzania of that link between data and advocacy and some of the successes that you've achieved as a result of kind of evidence-based advocacy. So I see that we're getting a few questions. What I'd like to do is wait until Michelle has had an opportunity to give her presentation and then take them. I will share the questions and we can get into more of a discussion. Our second presenter today is Michelle Weinberger, who is a demographer with a focus on family planning and reproductive health. As a senior associate at Avenir Health, Michelle provides technical support to Track 20, produces strategic analysis related to family planning and reproductive health, and supports the development of the family planning goals model. She has extensive experience in developing models and analysis to inform strategic policy and programmatic decision-making. Before joining Avenir Health, Michelle headed the impact analysis team at Mary Stopes International, where she oversaw the development of impact models and metrics. This included developing the Impact 2 model, which estimates the health impact of reproductive health service provision. Michelle has a Master of Science in Population and Development from the London School of Economics. So it's my pleasure to turn it over to Michelle.
Great. Thank you, James and Jay. So I think this is a really nice setup to hear from James some of the ways in which they, as advocates, are using data being produced by Track 20. And so what we wanted to do today is just give you a little bit of an overview kind of at the global level of the type of work Track 20 is doing, and then give you a short presentation of some slides that were presented earlier this summer at this year's annual consensus workshop. So for those who have not been able to attend the consensus workshop, to give you sort of a taste of the types of things being discussed. I want to say that a lot of this work and in country on the day-to-day is being driven by Dule Nkungu, who is our MNE officer, though unfortunately he wasn't available to join us on this call today. So I will be presenting a lot of this on his behalf. Next. So at a global level, Track 20 plays a role in supporting the tracking of annual progress for FP 2020, and this is done by tracking a suite of 18 core indicators that are produced every year in an annual report. This year's report will be coming out at ICFP next month in Rwanda, so hopefully many of you will be there to receive it or be able to get kind of online versions of it to get access. And the reporting is done at a country level in countries that have made commitments to FP 2020 with the idea that the values for these indicators are generated in country and validated and vetted in country. So trying to create a lot of country ownership of this data. And I think that FP 2020, by having this focus on monitoring on an annual basis, has really played a role in bringing data front and center. So creating these opportunities for partners in country to get together, look at the data, and think about that progress on a much more regular basis than happened in the past. Next. So as I said, Track 20 supports the production of these global indicators, but also works on a wide variety of other things, as you can see illustrated in this slide, around supporting countries to improve how they're using service statistics in their monitoring, to help build capacity within countries to better use data, as well as creating tools to support all of this work. Next. And as Dule sits in Tanzania, we also have M&E officers sitting or working across the pledging FP 2020 countries. And so Track 20's model is to really work either with existing M&E staff within a country, or where there's a need for additional capacity to find ways to create new positions for FP-focused M&E officers within governments, so that those people are really in the day-to-day work that's happening, and support them through trainings and through other kind of technical support visits throughout the year and remote support. And one of the big things that happens are these annual data consensus workshops, which we'll talk a little bit more about today. Next. So as I mentioned, Dule Nkunge is our M&E officer. He has been there since early 2016, so has been sort of shepherding this process along for the last couple of years. We've now had 4 annual consensus workshops in Tanzania. And during these workshops, the purpose is twofold. So one is to review and agree those core indicators that get reported up to that global level, so the values that will appear in the report. But we also see them as an opportunity to explore other relevant topics related to measurement and data in the country. And so this is just a list of some of the types of things that have been discussed in the past 4 years at these meetings. So some more in-depth analysis of the HMIS data coming from DHIS2 to really understand what that data is showing and talk about opportunities to improve how that data is collected and used. Secondary analysis of the DHS. So when that new survey came out, it was an opportunity to really dig into that data to understand the changes. And Dule also put together a special analysis just looking at youth and adolescents and what that survey told us about what was going on with them. We've seen results reviewed from facility-based surveys, including a SPA survey that was conducted, as well as from UNFPA's facility-based survey. So getting the picture from the side of availability and stockouts and discussing what that data means. While we don't have great data, and I think James also mentioned that budgets is a challenge, that we have had at least some good discussions about expenditure data and what might need to be in place in the future to get a better understanding of what is being spent. So we saw from James's presentation some really big commitments from the government towards family planning, but then actually tracking how those expenditures happen over the year. And then finally, and we'll look a little bit at this, had some really good discussions around understanding what the goal is in Tanzania, so that we're making sure that all partners and advocates are sort of tracking progress to the same point in time. Next. So who attends a consensus workshop? This is a picture from our workshop this year that happened in July. And we have a wide range of people attending, so ministry officials from a lot from Ministry of Health, but other relevant ministries as well. And we also brought in zonal reproductive health coordinators, so that we weren't just getting the national perspective, but also being able to bring in a little bit at least of that sort of subnational zonal perspective, as well as donors, implementing partners, and advocates. Next. So these are the full list of 18 core indicators that are reported to FP 2020. So over the next few minutes, I'm just going to take you through the first set of them, so numbers 1 through 8, which James mentioned are some of the ones that they use a lot in their advocacy in terms of being able to look at what current progress is and also what the impact of that progress is in terms of unintended pregnancies averted, and then the health impacts of that related to averting unsafe abortions and maternal death. Next. And one more. And just to say that while today we're going to look at sort of this global snapshot of these core indicators that are reported up, that there is also a lot of additional analysis looking at things that more focus at the country level. So that these core indicators really are just kind of the tip of the iceberg in terms of looking at data and understanding data. And those are what feed into this global reporting structure that FP2020 has created, but there's a whole host of other analyses and monitoring that happen that really kind of delve down into country level data that isn't reported up into that global space. Next. So this is the overall progress as currently estimated in Tanzania. You can see in the first graph, the blue line represents their current progress and a projection of where the country would end up if that current progress continues. So you can see that they're currently at a MCPR for all women of around 37, with that growing to about 39 by 2020. And in the green line, you can see their goal, which is to reach 45% MCPR amongst married women. Apologies, this is all married women data, excuse me, by 2020. And what we see is that while their growth is pretty decent, that being able to reach the goal would require more rapid growth than the country is currently seeing. And so this led to some discussions about sort of the ability to see that acceleration and achieve that goal, and what kinds of changes or investments might be needed to be able to push more rapid growth. Next. So a little bit about this goal. So we find in many countries, I think it's easy to kind of throw a goal out there, but as we look into it, sometimes it's not always clear what exactly that goal was intended for in terms of two different things. So one is whether it was a goal for contraceptive use among married women or all women. And also sometimes it's not always clear whether it's a goal for all contraceptive use or just modern contraceptive use. And the reason that these distinctions are important is it can make a big difference in what that means in terms of how many women need to be reached in a country in order to meet that goal. So in Tanzania, in their first SIP, Tanzania was the first country to develop a costed implementation plan. And in that SIP, they had set a 60% goal, which generally was agreed among advocates and partners and governments that was interpreted to be for all methods, so including both modern and traditional, and among married women. And as you can see, that 60% ended up within their pledge at the London summit. And then in the One Plan 2, which is Tanzania's RMNCH roadmap, there was a goal of 45%. And then there was some debate about who this 45% goal is for, if it's for all women or if it's for just married women. And so back in the 2016 consensus workshop, we had some really good discussions, and you can see some slides at the bottom there from that about the implications of interpreting that 45% goal as a goal for married women versus a goal for all women. And so what you can see is that because the population of all women is so much larger than the population of just married women, reaching 45% of all women would mean needing to reach almost 3 million more users than if that goal was really focused on married women. And also, as you can see from their achievement graphs, that, you know, in both cases, the country wasn't on a trajectory to achieve a 45% goal, but that the 45% goal of married women seemed much more feasible, that with some acceleration, that trend could possibly bend up towards that goal, but a 45% goal among all women was really not really very realistic and achievable. And so it was agreed going forward to focus on a 45% goal for modern contraceptive use among married women. Next slide. So just a little bit of background on where all these numbers are coming from. So within Track 20, we measure progress through a model called the Family Planning Estimation Tool, or FPET. It's a statistical model that borrows on work that has been done in other areas around HIV, around calculating maternal mortality rates and child survival. And the benefit of this model is that it's able to use all different data sources, including both surveys and service statistics coming from HMIS. And it takes all that data together and it estimates what's the most likely trend that a country is on. So both where they are now and where they're going to go to in the future based on all of this different information. So rather than just being reliant on one or two data points, it's able to really pull all of this information together. And so this model is used to produce our trend estimates for MCPR, as well as for unmet need and demand satisfied. Next. In Tanzania, the data that's going into this model, so Tanzania is a country that mostly just has DHS surveys. So in some countries, we see more of a mix in terms of having mixed surveys from UNICEF or PMA 2020 surveys, or sometimes some other national surveys. So in Tanzania, there's mostly just been DHSs, but a really long trend of them. So from 1990 all the way up to 2016. And also in Tanzania, they're able to use data from their DHIS2 system to help inform progress as well, which is really helpful because while that 2016 DHS is fairly recent, every year we get further away from that, then we don't have such recent data informing our estimate. And so being able to use service statistics lets us help estimate how the country has been progressing since that last DHS survey. Next. So these graphs just show example outputs from FPET. So the graph on the left shows what happens if we did not use service statistics, and the graph on the right, those little dots, represent the estimates from the HMIS system. So it's not a problem that they're below the line, because we know in many places there's reasons that service statistics don't sort of match the level of contraceptive use in a country. But what's really important is the slope, the shape of that trend. And so what we can see is that the service statistics follow a very similar shape to what we already saw in surveys. And we can see that largely they confirm that that sort of same trajectory of progress is continuing going forward. Next. So based on the values of the MCPR, we're able to estimate additional users. So how many more women are using contraception now than were using in 2012. And so we see that in 2018. So currently we estimate that there's about 1.4 million more women using contraception than there were in 2012. And that if the current trend continues, that number would grow to about 2 million by 2020. Next. And I think these numbers are very key and helpful to advocates, and hopefully we can hear a bit more from James about how they're using these. So we know that because women are using modern contraception, that they're protected from unintended pregnancies, and that because those unintended pregnancies don't happen, that they're also then averting unsafe abortions and maternal deaths. And I know in Tanzania, there's been a lot of talk about the MMR and maternal mortality. And so being able to kind of quantitatively link the investments being made in family planning and contraceptive use to their role in averting maternal deaths, I think has been a really powerful way to talk about the importance of making these investments in family planning. And you can see, so that little discussion box at the bottom was something that was up there during the consensus workshop so that we could have an opportunity in that forum with all of those partners together to really talk about how can these results best be packaged for advocates to use them. Next. So this is just a summary of the data that was reviewed and discussed and agreed and then ultimately reported up to FP2020, and that will be being published in the progress report that we'll be launching next month. Next. Next slide, please. And then just to highlight again, you know, this is just part of the discussion. So it was an all-day meeting, lots of really interesting things going on. So this morning, we were just able to summarize a little bit of it, but wanted to note some key things that were talked about at that meeting back in July, which was a lot of discussion about what's driving the progress and what more can be done for further acceleration, a lot of further review of the DHIS2 data and what we're seeing in the data, what trends are there, how that can be used both at a national level and a subnational level. And then we had an update as Tanzania is in the process of developing their SIP 2.0. So we had an opportunity to discuss the monitoring piece of that SIP and how that can be aligned to these wider data discussions in the country. Next. So that is just a quick snapshot of the type of work that Track 20 is doing in country and a little bit of a glimpse into the discussions that happened at that annual consensus workshop.
Michelle, thank you for a fantastic presentation. I really appreciate kind of the focus on one hand of the Tanzania situation, the process through which consensus is reached, looking at specific numbers and of the different indicators that you've got. So really very helpful. And one of the things, well, I learned a lot, but one of the things I really appreciate is first, that Track 20 brings more to the table than just the analysis with FPET of these core indicators that is part of your main mandate for FP 2020, but the ability to do, you know, secondary analysis of the DHS, looking at expenditure data, while all of these fit into some of the core indicators that you track. It's good to know that it's not, that there's lots of analytic tools in the Track 20 arsenal. So that's great. The other thing I really liked is about the consensus workshop, and it's not just the public sector talking with the data people, but really engaging donors, implementing partners, and advocates. And so I'd like to ask James a question before we open it all up. So the consensus meeting serves as a vehicle for getting everybody on the same page about the data. I'm wondering if there's anything related to the advocacy side of things that brings advocates together and comes up with a common agenda and who's going to be doing what. Because when we work together, we're stronger than when we work separately. So James, how in Tanzania do the advocates come together and coordinate, and does it work well? Could it work better?
Thank you, Jay. I would say that you know, participants in the consensus meetings mostly the same, if not I mean, if not different. Most are the ones that participate in the family planning technical groups and other technical groups on reproductive, maternal, newborn, and child health. So when in the consensus meetings, there are some issues that are discussed and agreed, but also out of those consensus meetings, dialogue continues in the other meetings that are organized for the technical working groups, and sometimes for coalitions outside the technical working groups. So the discussions are not only done during the consensus meetings, but I would say after the consensus meetings, the dialogues are more informed with the data that is obtained from the consensus meetings.
Great, thank you.
Yeah.
So I've received a couple of questions, and people please feel free to go ahead and start typing them in, and I've got a couple of additional ones that I'd like to throw in. But a question for James on AFP. Was there one particular tool or message that you think convinced parliamentarians to agree to increase the funding for family planning?
A tool or a message?
Yeah.
Yeah. From the presentation that Michelle has made, Slide number 27 is one of the slides that we really copied as it was and presented to show the members of parliament a number of times. And we showed how the country was making progress and what further was needed to be done in order to accelerate progress and what the results will be. The issue of maternal mortality in Tanzania, especially after the DHS, the most recent DHS was released, has been a major topic of discussion because the numbers have gone up and it has been an issue of concern. I think if I can remember properly, immediately after the DHS was released, we brought together some members of parliament and got them to go through the data, and they made a statement in regard to the situation in order to call for more attention to address the issue. So when we show that if family planning is used and progress is made to this extent by showing these numbers, then the outcomes will be as shown here: how many unintended pregnancies will be abated or prevented, how many maternal deaths will be prevented, and how many unsafe abortions will be abated. It becomes very clear, and the pictorial way it is presented is more attention capturing. So this is one of the slides. But if I can add, Jay,
sure.
We have also used the slides from track 20 on PPFP to engage people in councils and regional health management teams to show that by increasing focus on PPFP, this is how much can be achieved in terms of MCPR increase, but also in terms of other outcomes that relate to health of women and children. So these are some of the examples, Jay, I can present for now.
Great, thank you, James. We may come back to that. Another question I think is directed more toward Michelle. It says track 20 data and the consensus meetings are great, but where can we get data or on how can other organizations with, say, supply chain data contribute to the dialogue? So it seems like organizations that have specific pieces of important data to the big family planning picture contribute to the dialogue, the advocacy data dialogue.
Yeah, well, I think one of the principles of track 20 is being able to utilize a wide range of different data sources and kind of pull them together to really understand all the different dimensions of what's happening. And of course, the supply side of things is really important in that. And I think that data comes in a few different places. So one is we didn't look at them today, but there are some core indicators around stockouts and method availability. And so sometimes that data is being pulled from surveys, but increasingly what we're seeing is that data is coming from ELMIS systems. So as countries are improving how they're tracking their data on the supply side and being able to have these kind of more frequent and more robust measures of stock and availability, that data is coming into the picture. And just like we kind of do some deeper dive into the DHIS2 data, I think there's also opportunities to use these workshops to do some deeper dives into other data on the supply chain side where that's available, and there's whether that's in the government ELMIS system or coming from partners who are supporting that work.
Great, thank you. Are there any additional questions coming in from participants? If not, go ahead and type them in. And while you're doing that, I wanted to follow up. And this is, I think, a question for both James and Michelle. And I thought it was really fascinating, James, that one of the districts, I think, declared a teen pregnancy campaign based on the data. One of the things that we've learned, particularly at subnational level, is that it's very easy to get kind of the policy or the declaration put in place. I think the challenge is the follow through and the commitment to fund, to get the political support, to get people trained, etc. To, in this case, really focus in on reducing teen pregnancy. So if you could talk a little bit about kind of the advocacy for implementation of this declaration. And at the same time, Michelle, since this drew on Track 20 data to support it, are there creative ways to use Track 20 data to continue to support this subnational advocacy effort and really try to make progress on achieving this goal?
Thank you, Jay. Let me start by addressing the question on Katavi region. This is a region which has 6 districts or councils, as we call them, because some of them are called town councils, some of them are called municipal councils, and others are called, the rural ones are called district councils. AFP targeted this region, as I mentioned earlier, because it is the one, to the moment, that has the highest teenage pregnancy rate of 45%. And so we thought it was important to support the region to do something to show that it has commitment and to change the direction of these young people. So the region agreed to develop the action plan and declared or launched it in October 11th last year, when also the national campaign was launched. However, as you have mentioned, resources is the key. So the project, AFP project, has an objective on resource increase, and we continuously engage local government authorities, which are the councils, to increase resources to support implementation of interventions such as these or such as those outlined in the action plan. So the 6 councils in Katavi region are in the process of making sure that the resources are made available, but the project was able to target 1 council and then target the regional health management team, which oversees the councils, to engage them to make sure that the councils, which are the ones that are making budgets at that level, are making sure that resources are increased to address the issues. As of now, the country, Tanzania as a country, has a directive on making resource allocation or making allocations for family planning in every council budget every year. And this was out of an advocacy initiative that we conducted in the year 2014. And after it was issued, the tools for budgeting were inserted with a budget line, which has to be given money. I mean, an allocation has to be made in that budget line for the tool to allow the person operating it to close. It is an electronic budgeting tool called PlanRep 2. Now it's version 3. So countrywide budgets for family planning are made. The biggest issue is whether they're adequate or not, because we observed that there's no guidance specifically given to make sure that these allocations are adequate. So for us, we sometimes think maybe just to make sure the process is done or the process is closed, then any amount can be plugged there, 10 shillings, 100 shillings, or 10 million, but not considering adequacy of that allocation. So when we engage the councils, or when we target the regional health management teams, which supervise the councils, we put in the message that they have to make sure these allocations are adequate, or at least can adequately address the issues in that particular region or in those councils under the region.
Great, thank you, James. So it's an ongoing process of advocacy for implementation at the council level to ensure that the funding and other types of support are put in place. Michelle, any thoughts on how Track 20 data might be used creatively to support these subnational efforts, such as this one related to teen pregnancy?
Yeah, so I think, more and more in countries, what we're finding is that, while there's definitely utility in having data at the national picture, that, people want it at smaller and smaller levels, right? So down to the zones and the regions and the districts. And I think that presents both challenges and opportunities. So I think one of the challenges is, at least for certain data sets, like things coming from a DHS survey, as you drill down to those smaller areas, you run into issues with just your sample sizes not being very big. And so it's sometimes hard to produce reliable estimates for what's happening in those very small areas. But I also think this is where there's a great opportunity with routine data. So things coming from the DHIS2 or the ELMIS, because that data is collected down at that bottom level, at that facility level. And so there's a lot of visibility within that data that can help look at what's happening in different places at both a regional level and then even down to that smaller district level, or ultimately a facility level. And so there's work Track 20 is doing increasingly to sort of bring our estimates from the national down. So one thing is the FPET model that I talked about earlier. More and more in countries, we're running that model at a regional level instead of a national level, and then aggregating those results up to get a national estimate. So being able to produce those projections of MCPR region by region. And then also in our work around DHIS2, helping countries to look at how they can use that data to better inform some of the discussions happening at those lower levels. And so as part of some of the work James mentioned previously around some of the prioritization work that we were helping to do, we put together regional fact sheets that included both data from the DHS as well as the DHIS2 to really try to call out what we know about different regions and be able to highlight both challenges and opportunities at that lower level.
Great, thanks, Michelle. Another question, and we're almost out of time, but for uptake, it's important to link FP services to FP commodities. In Tanzania, are there examples of data being used successfully to advocate for this linkage between commodities and services?
So I can jump in on that, and then James, if you have anything to add. So I think this is happening increasingly, right? I think that you had these two different systems in Tanzania that both are sort of getting stronger, improving, and because both are electronic, there's increasingly opportunities to triangulate across the two. And so I think that there's been more work to try to look at what can we learn when we bring together that data on sort of services being provided to clients that's coming through the DHIS2 with the data that's coming through the ELMIS on the sort of supply side of things. So I don't know if I have any great sort of conclusive examples, but I do know that it's something that's being looked at, and there's increasing discussion about better ways to integrate those two systems, or at least elements of those two systems, to make sure that that complete picture is there.
Thanks, Michelle. I am keenly aware that we're a minute over, and so while there are a couple of more questions, I feel like we need to respect the time for the webinar. I want to thank, first of all, James and Michelle for organizing their comments and thoughts and making great presentations that focus in on family planning data and advocacy in Tanzania. And also to Ellen, who I think has masterminded this series of webinars. We appreciate everybody taking time today to participate, and I hope it's been a productive and useful hour for everyone. I've certainly learned a lot, and thank everyone. Ellen, do you have any final comments as the host of this?
No, just to say thank you to our moderator, Jay, and for all those who attended, and look forward to, ongoing discussions in the coalition on data for advocacy. Enjoy the rest of your day.
Thank you very much. Bye-bye.
Bye-bye. Thank you very much.
Thanks.